Maya, this is Felix, and I work in music publicity and book publishing. I live in Brooklyn with my boyfriend Peter.
Hi, I'm Julie. I am currently a massage therapist. I was an actress for 20 years.
My name is Zach. I was born in Newport News, Virginia, and came to Washington, D.C. in '71.
My name's Deirdre, and I'm a clinical social worker. I'm married, have a husband, George, and a son, Ty, and we're expecting our second in a few months.
Hi, I'm Peter. I'm Deirdre's brother. I work as a tax consultant, and I live in New York City.
I'm Margaret, and I'm back in school. This is #1 priority for me. I'm also a member of University District Alumni Dance Troupe.
My name is David, and I was born in Brooklyn, New York, and I went to law school at the University of Buffalo. I was never able to pass the bar exam, which I attribute not to my intelligence, but to mental illness.
I'm Peter Bogdanovich. I'd like to welcome you to Achieving a Balance, a beginning of hope for patients with bipolar mania. This short video is a story about people with bipolar disorder who, by learning to cope with it, are now enjoying productive and happy lives. First, let me introduce myself. Some of you may know me from my work as a film director. In fact, I've spent a lot of time in screening rooms just like this one, reviewing footage from films I've directed, such as The Last Picture Show, What's Up, Doc, and Mask. More recently, you may have seen me on the other side of the camera as the psychiatrist, Dr. Elliot Kupferberg, in HBO's Emmy Award-winning series, The Sopranos. I don't personally suffer from bipolar disorder, but I have struggled to find the right ways to aid someone very close to me who does. I've been there for my friend during the mood swings, witnessed his fear of talking about his condition, and seen the impact his illness has had on every aspect of his life. And so I've felt the sting of bipolar disorder. I've also seen how important it is that everyone impacted by this condition be educated, both about what bipolar disorder is and about the hope that exists for bringing life back into balance. In this video, we'll meet 7 people from all walks of life. Their common bond is bipolar disorder, also referred to as manic depression. During this video, you'll get to know these people as they describe how they've learned to live with bipolar disorder. You'll also meet 2 medical experts whose work has focused on the treatment of this disorder. Dr. Paul Keck is professor and vice chairman for research in the Department of Psychiatry at the University of Cincinnati College of Medicine. Dr. Ronald Kocius is assistant clinical professor of psychiatry at Georgetown University Medical Center in Washington, D.C. Both of these doctors understand how important it is for patients to learn about bipolar disorder and its treatment. Your doctor has given you a prescription for Zyprexa. Zyprexa is a new treatment for the acute manic symptoms associated with bipolar disorder. This mood stabilizer for bipolar mania can help improve symptoms such as elevated mood, sleep disturbance, poor impulse control, and excitability. It can also improve cognitive symptoms to help with concentration, organized thinking, and insight and judgment. This may help you lead the kind of life you'd like. Taking your Zyprexa as prescribed by your physician may be the first step in this process. All of us who've been involved in the making of this video hope that by watching it, you'll learn something to help you better understand this disorder and how you and your doctor can start to bring your life back in balance.
I couldn't function. I lost my job because of it.
I had really lost it to the point that I was not able to care for myself.
Bipolar disorder is also called manic depressive illness. It's a very common and severe psychiatric illness that affects an individual's mood, behavior, and thinking.
I have racing thoughts.
You feel like you can do anything in the world.
I'm like lashing, and I don't even realize I'm lashing out at people.
Mood problems in bipolar disorder consist of severe swings into euphoric or very happy mood and alternatively severe periods of depression.
For a while, I feel like I'm being super productive and like getting all this stuff done, and I do. But then I look back and I've like made all these mistakes.
I just put thousands and thousands of miles on the car, driving needlessly.
Also had symptoms of excessive spending sprees, increased sexual behavior.
The cycles of mania and depression in someone with bipolar disorder can vary. Someone with a relatively benign course of the illness can have a period of mania or depression and then go without being ill for many, many years. Other people have a very severe form of the illness called rapid cycling, in which they can have periods of mania or depression as many as 2 or 3 or 4 in several months' time, and with very brief periods of feeling back to normal.
And all you want to do is just lay in the bed and just lay around.
Low self-esteem, you know, not thinking that I was worth too much or able to do too much.
During a manic or depressive period, someone with bipolar illness can have feelings of paranoia, suspiciousness of other people and their motives, or feelings of grandiosity, feelings of having special powers or abilities that they don't really have in real life. And those are really delusions.
I thought that the people in the law firm I was working for were poisoning my coffee.
I didn't want to get help and I was avoiding getting help. And then finally I got to the point where I attempted suicide, and that was what brought me into treatment.
I realize now that what happened during the events that happened were not fun. They were hazardous, and they were senseless, and they were expensive, and they were stupid.
Many people who suffer from bipolar illness don't recognize that they're suffering from a condition because, especially during their mania phase, they feel good about themselves. They're able to get a lot of work done. They're able to be gregarious. They lose their shyness.
When I was first diagnosed, the issues that basically popped into my head were issues of being labeled, being afraid of being labeled.
When I started reading literature and material about bipolar disorder, I realized, wow, this is exactly what I have. I've had all these symptoms of mania.
I think it's important for people not to feel that it's a character flaw.
It's not something that fortitude and harder work can prevent from occurring.
It's not something I can really control. It's what it is. If I had diabetes, I'd say, okay, I have diabetes. I'm not, you know, that's just something I have.
The cause of bipolar disorder is not exactly known. We do know that it is a brain-based medical illness that involves certain structures of the brain that control emotion, behavior, and thinking, and involves certain biochemical imbalances in neurotransmitters.
My mother had been bipolar, and so had several of my siblings. So I knew we had a family history.
She was hospitalized in my lifetime, I know, at least 3 times.
Virtually anyone can be susceptible to bipolar disorder. The general prevalence in this country is that about 1 out of 100 to 2 out of 100 people will develop the illness over the course of their lifetime. The illness does run in families, and we know that there is a strong genetic component.
When I first got pregnant, people would ask me, are you sure you want to have a baby? You know, that you know, genetically there's links and you know, possibility that my children could have this illness. And it's something that my husband and I definitely discussed, and something we had to keep in mind when we were planning to have a family.
What's he doing? What's he doing? Is he taking a picture of you?
Yeah.
But I think for us now as parents, we'll be much more aware of any inkling in our children of having any kind of symptom, and hopefully be able to get them to treatment quickly, which we know, you know, these days works.
It's not something that can be cured, but rather we like to think of it as something that can be managed.
It's an illness that can be treated.
I use medication to help my patients get their mood stabilized, especially during the acute manic phase, so that they can begin to learn about their condition, they can begin to get their life back on track.
I'm lucky, you know, living in the age I do now, that there are effective treatments. Medications are much better than they were when my mother was first becoming ill and being diagnosed.
When my doctor introduces a change in my medication, what helps me the most is keeping myself informed.
Because I'm the one who's going to be taking this, and I need to know all the information about it.
And that knowledge sort of gives you a feeling of control over the situation.
I can live with being, 5 or 10 pounds chunkier if I'm not, going to be staying in bed for weeks at a time, or that's a trade-off I'm willing to make.
Like other mood stabilizers, Zyprexa may be associated with weight gain. If this weight gain occurs, I use that as an opportunity to educate my patients about proper nutrition and the role of good nutrition and eating habits in the maintenance of their mental and physical health.
I think it's a very good idea for anyone taking Zyprexa or any other medication prescribed by a doctor to let that doctor know immediately if they're experiencing any bothersome side effects.
Sometimes I've been tempted to stop taking the medication, but I stay on it because I really believe that the medication is doing more good than it's doing harm.
Like all prescribed medicines, it's important to take Zyprexa as your doctor has directed, and usually that's once a day dosing. If you miss a dose of Zyprexa, you may want to call your doctor to find out if you can skip the dose or whether you need to take it before your next scheduled dose. Also, if a person taking Zyprexa is unsure that an over-the-counter medicine, let's say, might be affecting their use of Zyprexa, they should consult their physician. Like all medications, using alcohol and illicit drugs can work at cross purposes with the intent of the medication. It's important that there be an honest dialogue between the patient and the doctor regarding alcohol and drug use.
I want my family and friends to understand that right now I can't work because I am ill with an illness that's a diagnosed illness.
I just want them to understand that I can be independent on my own.
If I'm cranky or irrational, that it's certainly not my intention. That sometimes I just can't control it.
There are a lot of very key people in my life who've shown themselves to be constant, regardless of what's going on for me. So I have that confidence that they're going to be there regardless of what happens.
I still loved her, and I was willing to stay and stand by her and help her get through those times.
The important thing to remember is that family members should be as supportive as they can to help someone with this illness get into treatment and stay in treatment.
When my patients are stable in their mood, I educate them as to the times when they need to pay attention that their behavior or their thinking is getting out of control.
For me, the leading indicator of trouble is sleep disturbance.
If all of a sudden I want to do something very extreme.
If I had the urge to use, that would be a main trigger. When I say use, I mean alcohol or other drugs. That would be a huge trigger.
A really important one for me is if I'm having trouble focusing, if my mind's sort of spinning.
If I saw any of those triggers of mania coming on now while I'm on medication, I would immediately call my doctor.
Family and friends are critical in working with someone who has bipolar illness because they're often the people who first see the mania come to the forefront. They're the people who often have to care for the individual and contact the physician. Some patients may regularly check in with their doctor about their moods. Other patients do mood charts, and still others keep journals about how they're feeling.
I write a lot about the sessions that I have with the therapist. I write about how I'm feeling about things or incidents that happen, and sometimes just the act of writing helps shift my mood.
I keep a tab on how my day go and how's a good day or bad day. If it's a plus day, I put a plus day.
It's helpful in that I see the progress, because there are some days that I think, oh my God, I'm in the same spot I was 2 years ago, and I'm really not at all.
I only take medication in the morning, so I keep it in the bathroom.
Typically, I do a lot of walking. I do the walking because I find it very therapeutic.
By attending support groups, I've really been able to learn a lot more about the disease and the illness and what has been effective treatment for other people.
Being able to get the treatment I need rather than living in denial and pretending I don't have it, has really helped me to stay healthy.
I wish that I had somebody hand me a video and say, here, watch this.
I agreed to participate because I'm happy that this medication, Zyprexa, came out.
I think it's important for people to see, especially when they're first diagnosed, that it's possible to lead a normal life and that you can get past it and be happy and do the things that everybody else does.
You know, I've always felt that choosing the right person for a role is half the battle in successful filmmaking. In this video, we've been fortunate to have participants who've been willing to share with us so honestly. While they still struggle with bipolar disorder, these people are a real inspiration and living proof that there are treatments that work. Zyprexa is a new medication that may prove helpful in treating the symptoms of bipolar mania. Not only has it proven to be effective, but it's also easy to use, doesn't require blood monitoring, and is generally well tolerated. Although there is no cure for bipolar disorder, the good news is that by following the directions for taking Zyprexa as prescribed by your doctor, you may begin to see balance restored to your life. I'm Peter Bogdanovich. Thanks for watching.